Good morning. My name is Frank Hester. I'm the CEO of TPP. We write software for healthcare and we deliver EMRs all over the world. I'm filming this today from England. Unfortunately, I can't be there physically with you because I've broken my hip. But I'm there in spirit and in heart, and I wish you all the best for this conference. First of all, I would like to welcome the very Honourable Mr. Wang Guangchang, the Chairman of China Medical Association of Minorities, Su Guangqing, and from Traditional Mongolian Medicine branch of the CMAM, Chairman Wu Lan, and from the Psychotherapy Medicine branch of the CMAM, Chairman Na Gong. And my last welcome is for the distinguished Ni Rong, my friend, President of the Internet Health Industry branch of the World Federation of Chinese Medicine Societies. Wish I was there with my friends and colleagues, but this hip will take some time to heal. So I'm looking forward to seeing you in the Chinese New Year. And also to all the colleagues who've been working hard for the development of Chinese traditional medicine and innovations in Chinese national medicine. I'm very honoured to be able to address you today, especially when we think that Chinese traditional medicine has been developed for 5,000 years. The economic, social, health achievements made in the decades of China's reform and opening up have been remarkable. They've been recognised right across the world. I think it's an achievement which will be celebrated in the history of mankind. At the same time, in the UK, we have noticed a rapid growth in the fields of traditional Mongolian medicine and psychotherapy and Chinese traditional medicine. The CMAM aims to bring together academic knowledge from across the world to exchange scientific research, technological innovation, treatment concepts, and the development prospects in the field of Mongolian traditional medicine. In order to do this and enhance the capacity of ethnomedicine and mental health services, the CMAM has decided that the 2024 Academic Annual Conference of Traditional Mongolian Medicine and Psychotherapy should leave Inner Mongolia for the very first time. And it's been brought to the Yangtze River Delta region, the powerhouse of China's economic and social development, and specifically to Hangzhou, the city of the Asian Games. Well, it was also the first city that I visited when I came to China. And I met my friend Ni Rong and he walked with me across the West Lake. It was a happy start to my journey of understanding more about China and traditional Chinese medicine. Across the world, mental health has not been perhaps paid attention to or given the care that we could have done. Sometimes it's seen as an embarrassment or some sort of curse. It comes in varied forms, and I'm pleased to say that there's more and more recognition of this debilitating disease across the world. It feels like you are sitting in a black tunnel. There is no light. You can't see the way out. I was suffering with this condition when I first came to Hangzhou. And I started to see traditional Chinese medicine, a completely different approach to what I was used to. Western medicine, much more holistic, much more taking the world as one and taking yourself as one. I was able to use some of the features that I'd learned about, such as meditation and exercise, just going for a walk, to help me on my journey out of mental health. to find the light. Traditional medicine over the past decades has been more and more recognised. There's an awful lot for us to learn from this practice which has been going on for 5,000 years. And I can't help wondering, what else can we learn? Which leads me on to digitisation. Using computers, it allows us to more easily share results across the different physicians. The computers can help us, especially with AI, artificial intelligence. They can help remind us, making sure that we're doing everything for the patient, and they can help us more efficient. I think this is a fantastic opportunity to bring traditional medicine from this 5,000-year journey into the 21st century, something which can benefit the world and hopefully can benefit all of us. Just mention a few of the ways that IT and digital developments can help us. The first one is online consultations, letting people fill in the details about their mental health and well-being online via smartphone apps, and then sharing that information with their doctors. I mean, this is especially important, I think, in a country as vast as China. And this empowers patients, connecting people with their care team. Think about a new mother who's gone home with her new baby. This can be the most difficult and challenging time. Sometimes they can suffer with depression and anxiety. The smartphone app gives them a direct route to communicate with their doctors and nurses to help them out of that, as I've said before, that dark tunnel. The smartphone can give people a new voice or amplify their voice and connect them with the right healthcare physicians. Also allows families to care for each other, proxy access. In the case of my mother might be too elderly to use a smartphone, but I can use it on her behalf. I can see the records, I can request changes to her regular medications, I can monitor my mother's health, and especially as young people sometimes aren't living in the same places, they've moved to the cities, and this allows a direct connection back to their loved ones. So they're just three of the things, but it would be remiss of me not to mention AI, something I've personally worked on, artificial intelligence. When I first started talking about this a few years ago, I think it was new to all of us, including me. We'd built AI and we sat in wonder looking at it. It was like a miracle. Now, of course, it's going right across the world with revolutionary software such as ChatGPT and ErnieBot here in China. I think we're at the start of something here. AI is very, very good at dealing with documents and reading the kind of notes that are used in mental health. And I'm looking forward to the synergy of AI, digitisation, traditional medicine, and of course mental health, something which is very dear to my own heart. Well, thank you once again, everybody. And I wish I was there, especially because it's Hangzhou and the West Lake, and a place that I know is full of my friends as well. Thank you.